My name is Daniel Lewis, and this is initiating an IV piggyback. So the first thing I'm going to do is verbalize the six right of medication administration, right patient, right drug, right route, right time, right dose, and right documentation. So I'm going to go ahead and check the orders for this one. So it's administer clofurain 560 milligrams IV piggyback every 8 hours. I already have a reconstituted bottle of that, which is 500 milligrams per milliliter. I've done the calculations. So 560 milligrams is going to be 1.1 milliliter. And I'm going to place that in a 50 milliliter solution bag or saline bag, and it's going to be infused over 45 minutes. So the first thing I'm going to do is I would go into the patient's. Well, first off, I would do the 3 checks, making sure that I have the correct medication, everything like that. I would have already verified the patient, making sure that it was the correct one. I would check to make sure the dosage is correct for this patient, which in this case, this is a good dosage for an adult patient. And then I would check to make sure none of my medications are expired, which in this case I've checked and they're all not expired. I've already calculated the dosage correctly, and so I'm going to go ahead and open up a alcohol wipe and clean the top of this medication vial. All right. And I've attached, here I have a 3 milliliter needle, or 3 milliliter syringe with a filter needle on it. So I'm going to go ahead and pull back 1.1 milliliters of air and insert that into the medication vial and put in the air, and then flip it upside down and pull back the medication. And again, I'm doing 560 milligrams of the antibiotic. So, I pulled back a little bit of air. So I'm going to go ahead and make sure I only have 1.1, which is right there. Now that I have this, I'm going to go ahead and recap the needle. Oh, stop rolling on me. And recap the needle. And then I'm going to go ahead and take off the filter needle. And then I'm going to put on the sterile needle that I will use to do the injection. And then once I actually inject the medication in here, I would get the red medication label and make sure I label it with, let's see, the dose, the medication that I administered, everything like that, the date, the time, my initials. Now I'm going to go ahead and clean off the ports at the bottom of this saline bag. And then I'm going to go ahead and inject this into I don't know if you can see this. I'll do it like this so you can kind of see it getting injected. And I'll go ahead and pull that out. And I would just put this in a sharps container, but I don't have one, so I guess it does have a safety. I can just do the safety. But anyway, put it in a sharps container. So now that I have the medication in there, I'm going to go ahead and rock it back and forth, making sure it mixes fully. Alright, and I already have the peripheral IV inserted on this, so I'm going to grab my secondary tubing and my hanger, I don't actually have a thing at home here, so my IV bag is right here, but we're going to say it's on a pole. So I will get my IV tubing out, and I will close the roller clamp on this, making sure I do not touch these with my hands, keeping aseptic technique. I'll go ahead and uncap that and uncap this. And then with a twisting and pushing motion, I'll go ahead and spike this IV container, just like that. Now that I have this opened up, I'm going to, again, I would hang this on the pole, but I don't have a pole, so I'm just going to hold it with my chin and slowly, oops, take this cap off, slowly open this up to prime the tubing. Oh wait, I forgot to squeeze the drip chamber. So I'll squeeze the drip chamber and fill it up about halfway. Now I'm going to prime the tubing. Alright, so there the tubing is primed. Again, this would be hung up. At this time, I would hang the IV piggyback up. I would move the normal peripheral IV, or the normal bag of solution, lower using this right here, but I don't have an actual like thing to hang it on. And then I would hang this higher so that this is hanging above the other IV. Again, I don't have that, so it's just going to go here for now. Act like it's there. So I'm going to go ahead and put this cap back on here to make sure it's sterile. Next thing I'm going to do is I'm going to go ahead and clean this port on the actual IV tubing before I connect it. Alright, so I'm going to, again, if I can, I'll take that cap off, and then I'm going to go ahead and attach the piggyback to the primary IV. Again, this would be hanging above the actual normal IV like that, but I don't have a thing, so it's just going to go up like this. Once it's connected, I'm going to go ahead and open this roller clamp. And so for I need 68 mils an hour or a drop factor of 11. So I would actually, open this roller clamp and count the drips, make sure that I have the correct drop rate, which it's not actually hooked up to anything right now. So, yeah. So anyway, that's going there. Now that I have that done, it's going to infuse over 45 minutes. So I'm going to act like I'm leaving the room, and I did forget to perform hand hygiene before I did this, so I'm verbalizing that now. I did hand hygiene at the beginning, and then I'm doing hand hygiene at the end. I leave, come back to the patient's room, I'll knock, I'll perform hand hygiene. Now that they are go ahead and finished with the IV piggyback, I would discontinue the IV piggyback, and I would put the main IV back to its original height, and then document the infusion, how the patient did, everything like that, into the MAR and my nurse note, how the patient's doing, if there's any reactions, that sort of stuff.